coming to grips with the fact at 35 years old, you have breast cancer.
Mm-hmm.
What was that like?
Very difficult. And to this day, it's still difficult.
Everything seemed perfect. Heather Toplak and her husband were enjoying life with their daughter. And then cancer reared its ugly head. Without warning, Heather was fighting for her life.
You put on your battle gear and you just go into it head first. You want to get better. You want to get stronger.
That's exactly what she did. Over the past year, Heather Toplak has gone through a double mastectomy, 6 rounds of chemotherapy, reconstruction, and 2 additional surgeries. And she says her insurance carrier, Blue Cross Blue Shield, paid for everything along the way. After going into remission, her oncologist ordered what's called a CEA tumor marker panel, a blood test to show cancer levels in the bloodstream.
It's a $77 test.
Exactly.
After paying for all of her cancer treatment along the way, Heather says she was shocked when they refused to pay for the $77 test.
Here's the denial.
The insurance company said the blood test was not medically necessary. Heather's oncologist wrote this letter to the insurance company stating that the CEA tumor marker is, quote, standard of care for breast cancer, and that this is a routine test. Instead of approving the $77 blood test to make sure her cancer wasn't back, Heather says the insurance company approved a PET scan, which can cost thousands of dollars.
Why did you want to call 3 on your side?
To bring awareness to it. It wasn't a factor of money. It was a factor of principle. That, you know, our insurance companies are paying thousands of dollars for tests left and right that cost us thousands of dollars, but they're denying a preventative $77 blood work.
If you're not going to allow physicians to use the latest therapy, the latest studies on patients, you're tying their hands behind their back. And the one who's going to get hurt is the patient.
Dr. Richard Dolinar does not treat Heather Toplak, but says her story is not unusual. He believes insurance companies need to do a better job of listening to the doctors.
Doctors are in the business of trying to save lives.
In Heather Toplak's case, her oncologist ordered these blood tests to monitor if she's still in remission, tests that could save her life and could save the insurance company a lot of money.
I'm not going every 3 months or every 6 months for a PET scan and a CAT scan. It's $77. But if the insurance companies want to fork out $10,000 every 3 months, I can gladly do that.
Because they've approved that.
They've approved that. But I don't feel it's not necessary at this point in my treatment.